Overcapacity and stretched to the limit. Sound familiar? The head of the emergency department of McMaster Children's Hospital says the healthcare facility has never been as strained as it is right now.
Yeah, that's right. In a briefing today, the federal government says while COVID may now be on the decline, RSV and flu cases are still going strong, hitting pediatric hospitals the hardest. As Kelly Botello tells us, the shortage of children's fever meds is making the problem worse.
With inpatient occupancy at 140%, McMaster Children's Hospital is struggling.
Right now, the hospital as well as the ER is absolutely full. We've never faced these volumes before.
The good news, Canada's top doctor says COVID infections could start to come down now.
That resurgence appears to have peaked, and we may have just passed the peak of that latest upsurge.
But hospitals can't catch a break with a triple virus threat. Dr. Teresa Tam says it's the combination of RSV, COVID, and the flu that's creating a difficult situation for hospitals across the country. So much so that MAC is coming up with a plan to transfer some teens to adult hospitals.
Again, something that has never happened before and is something we're now being forced to do from the sheer volume of patients that we're facing.
The head of MAC's emergency department, Dr. Christopher Solowski, says wait times in the ER can be up to 12 hours right now. And in some cases, the visit could have been prevented if families had access to kids' fever meds like Tylenol or Advil.
It's really putting a strain on a lot of families and kids. It's really adding to what we call fever phobia. And that's the fear of children having high fevers and how that affects them.
Bare shelves, a problem across the country. A nurse in Toronto says the lack of kids' meds is exacerbating the problem.
Parents that come in that have tried resources of trying to obtain Tylenol or Advil, children's Motrin, or any form of over-the-counter medications for their children, but there's simply nothing left.
Dr. Teresa Tam says Health Canada is looking outside of the country to secure the medication.
The importation of supplies such as ibuprofen from the United States and acetaminophen from Australia.
Dr. Solowski says in terms of fevers, parents should pay attention to hydration, how much a child is drinking and urinating, not so much the number on the thermometer. But if the fever lasts for longer than 5 days, it's time to see a doctor. And if that means a visit to the ER, prepare to stay a while.
We understand that it's frustrating. We're not happy with the wait times either. Please understand we're doing the absolute best we can.
Dr. Solowski and Dr. Tam reminding everyone, children included, to get a flu shot and be up to date with COVID boosters. Kelly Botello, CHCH News.